Good afternoon, everyone. Welcome to our COVID-19 update for February 2nd. Pleased to be joined by Kendra Schmidt from Deaf Access Services to provide the American Sign Language, and Dr. Gail Burstein, who you'll see from very soon as we give an update on the matter that is COVID-19 and the response now, which is vaccines and all the issues associated with that. Through January 31st, there are 56,971 confirmed COVID-19 cases in Erie County. The 7-day positivity rate was 5.1% for the week ending January 30th. On January 31st, which is the last date of data we have, there were 387 COVID-19 patients in Western New York hospitals, 93 in the ICU. 303 of those patients were in Erie County hospitals, of which 77 are in the ICU. 48 were on an airway assist. Unfortunately, 6 people died in the hospital from COVID-19 on January 31st. And we certainly have, unfortunately, more news to talk about with regards to increased mortalities in the last week. So we offer our deepest condolences to the families and loved ones of those who've died. And of those in the hospital on January 31st in Erie County, 35% of them were age 64 or under. With regards to testing, we had the lowest number of confirmed cases that we've seen in quite some time. We also had the same positivity rate as the week before. So the total cases went down from the week before, but the total number of tests went down, so the positivity rate was the same at 5.1%. We actually had a couple of days were very low. We're glad to see that. And I'm hopeful that what I'm hearing from our numbers today, we'll have a very low number with regards to total confirmed cases, and I'm hoping that means a very low positivity rate as well. We have seen a drop. There's still COVID in the area, and it's not unheard of to see 500 new COVID-19 cases in a day. So we just want people to understand that COVID is still out there. We are not back to normal. While the yellow and orange zone restrictions have been lifted, that doesn't mean we're back to normal. So the new case totals are stable, down 4% from the previous week. And we have seen a decline in diagnostic tests reported during January from where we were earlier in the month of January. The new COVID cases by zip code for the week ending June 30th, you'll see that Amherst, Williamsville, Clarence 14221 is still number one on total new cases of 176, followed by West Seneca. What you will note is the positivity rates are lower than they were in the past. Even the 14221, which is leading, is a positivity rate for all tested of 4.3%. The cases per 100,000 in population were in the 40s and 50s now, where beforehand we were 70 above, some even 100 and above on a weekly basis. So we are seeing a drop in overall cases. That's a good thing. We're also seeing a drop in the positivity rate. We're seeing a drop in the cases per 100,000 population on a 7-day average. So let's just keep it up. We want to see these numbers continue, so let's keep those going. Hospitalizations, the last 2 weeks, you can see on the chart there has been a drop from nearly 400 cases, 394, to 303 by January 31st. So we are seeing a drop. We have started to see a little drop in the ICU numbers, though unfortunately of those that are in the hospital, 25% of all the individuals in the hospital with COVID-19 are in the ICU. That means they're very sick. And when it comes to hospital beds, we are not anywhere near like we were when we were in the peak of the orange zone, when we were at 15 to 20% of our hospital bed capacity left. 65.2% of our hospital capacity is occupied, which means there's approximately 35% of all beds available. One thing that we have seen in the last week since we talked, as there have been a number of deaths in the hospital, and we expect those still to continue for some time. The conversation we had with hospital CEOs last week indicated that for the average individual who gets admitted, who does not have to go to ICU, they're probably released from the hospital in no more than 3 days. For the individual who's in the ICU, they are in the hospital at least 10 days or more. And some of these individuals who've been in the ICU have been in there for a while now. So we know that there are some very, very sick individuals in our local hospitals with COVID, and we certainly wish them the best and a speedy recovery. We have seen a little drop in the number of individuals that are on airway assist. but we've also seen during that same period a number of deaths, and they often correlate with the number of deaths to those in the ICU and the airway assists. And when we're talking about deaths, we can look at mortality data for the beginning of the pandemic, our first death in March of 2020, to what we have through January 29th of 2021. There's 1,511 reported deaths total confirmed in Erie County. Let me just, usually don't have my phone, but for whatever reason I had it in my pocket, so I'm just going to get rid of that. But 1,511 reported COVID-related deaths. And since the beginning of the outbreak, 237 of them were in the month of January alone. So once we get the final numbers, it's possible that January will be as bad as April and May was last year. I don't know. It usually takes about a full week after the closing of a month to get the full data for that month. But 237 individuals have died that we can confirm in Erie County during the month of January, and as you see, there are 2 individuals that were under the age of 40, 3 under the age of 50, 7 between the ages of 50 to 59. So it's not just the elderly that are dying from COVID-19, and as I've talked to a lot of folks, including some who got it and have been very sick and thankfully have recovered, you have no real way to understand or what COVID-19 is going to do to you until you catch it. Including some people who were really good shape, a lot better shape than me, who caught it and were very ill. And they said when they thought, if I got it, it'll probably be okay, and then they were dealing with a major illness for quite some time. So you want to avoid it as much as possible. I used to say the phrase, avoid it like the plague. I think for now we're going to be talking for quite some time, avoid it like COVID, because you never know how it's going to impact you until you actually catch it. Erie County responds. We'll just talk a little bit about back to business before turning it over to the doctor to talk about vaccines and what's happening with that. We have a COVID impact loan program through the Erie County Industrial Development Agency that some companies are starting to take advantage of, I should say, and we want people to take advantage of it. You have to be located in Erie County, been in business for a year, and you have to have 50 or fewer employees, so for small businesses, but you can get a loan up to $250,000, and they're very low interest, 1%. You're not going to get a loan like this anywhere else. And they're interest-only payments for year 2 after no payments for year 1. So this is a great opportunity for a business that's having a little bit of issue, but maybe needs it for various portions of your business to help grow it, to take advantage of an exceptionally great COVID impact loan program, low interest. And then the CIDA last week approved a continuation of our small business PPE cost reimbursement grant program. These are actually grants. These are not loans. Once again, the numbers are very similar. You must be located in Erie County, have less than 50 employees, located in highly distressed areas, and you can get reimbursed for your PPE costs. And for both of these programs, call 856-6525. Call the Erie County Industrial Development Agency for more information. Once again, 856-6525, extension 126. Shop 716 gift card is still going on. You can still buy these cards. They do help our local businesses. More than $1 million has been purchased in cards, over 30,000 cards, and we're still selling them. So you can get those through amherst.org/shop716. So Valentine's Day is coming. You don't want to give somebody a box of chocolates or flowers, though I'd probably recommend flowers is not a bad thing to do anyway. You can still give them a Shop 716 gift card so they can go shop at their favorite local establishment and help support our local businesses. And now, oops, I skipped something here. Eviction procedures. We want people to understand that eviction protections still exist in our community because New York State has extended the eviction prohibition until the end of this month. So if you are at risk of being evicted and you can submit a hardship declaration that you have been negatively impacted as a result of COVID-19, lost job, lost income, you can avoid eviction. You can go to a website I'll read it. It's bit.ly/declare hardship, all one word, to learn more information about it. Once again, it's bit.ly/declare hardship to learn more about how, if you qualify or you may qualify for a tenant hardship to avoid an eviction proceeding. Erie County has just been informed that we're going to receive some additional money to help tenants avoid eviction and pay for their costs of their rent, so that'll help landlords out. We did it previously through a program that we had in the CARES Act. With the most recent round of federal funding, we've also received additional funding. So we're going to be putting that program together just as well. But in the meantime, if you are facing an eviction and you have faced a hardship, you have to make a declaration. You can't just say, well, I don't want to pay my rent. You've got to show that you actually have had a negative impact from COVID, then you could avoid eviction. And with that, I'm going to turn it over to Dr. Burstein to talk about vaccine delivery and what's happening now that we actually have some vaccine coming back to Erie County, which we will use to reschedule the appointments that were previously canceled.
Thank you. So I'm going to talk about a couple of hot topics. First is vaccines, and then I'm going to talk a little bit about COVID testing. So as you all know, we've told you before that the federal government controls the vaccine supply to New York State, and New York State controls the vaccine supply for Erie County. So we are at the mercy of the state, and the state is at the mercy of the federal government for our vaccine supply. The good news is that so far, we have administered from the Erie County Health Department vaccine pods 18,278 first doses and 1,514 second doses, and that was through the month of January. This week, starting the beginning February 1st, we have 1,700 doses. We actually just received those today, and then we are going to use those 1,700 doses to schedule and administer a vaccine for people whose appointments that we had to cancel because we didn't have enough supply. Also, we received an additional 300 doses that was earmarked from the state for a special closed pod for residents and staff at OPWDD facilities. So just in terms of how we are rescheduling these canceled appointments, so it's it's a long slog. It's very difficult with the state systems. However, we are doing it. Today we have started to send out emails, and we have to send out each email one by one for each canceled appointment that we're trying to reschedule to those individuals. And we're starting with the first day that we had to cancel vaccine appointments, which was January 8th. So hopefully today, everybody had an appointment scheduled for a vaccine on January 18th. Again, we're starting for January 18th, should receive an email from the Erie County Health Department. So we are going to reschedule these appointments for the same time and the same location as you had your initial appointment for. So just expect that. So as you can imagine, we're only receiving 1,700 doses a week for our general population, and we have over 9,000 vaccine appointments that we had to cancel and we're trying to reschedule. This is probably going to take all of February and maybe even a little bit longer. We're hearing back from some of the people that we've emailed that they can't make the appointment or they've already received their vaccine in another place. So please let us know if you can't make the appointment for one of those reasons. You cannot give away your appointment. We have the names of everybody on the list whose appointments we had to cancel and we're rescheduling. And so if you say, hey, I'll give you my appointment, and that person was not on our list of canceled appointments, we are going to turn that person away. We are going to hopefully schedule more of those first dose appointments for 1B for people who we hadn't had to cancel appointments, for new appointments sometime after we're done with rescheduling these appointments. But again, that probably won't happen until the month of March. And so again, the state has been very prescriptive of who vaccinates whom. So right now we are trying to vaccinate people who are at high risk of being exposed to COVID-19 or at high risk of becoming very, very ill if they are infected with COVID-19. So those are people in the 1A category and the phase 1B category. So the county health departments are directed to vaccinate people in the 1B category. category, and pharmacies are directed to vaccinate people who are seniors 65 and up. However, if you're not in any of those, if you're not in the 1B category, if you were in the 1A category or 65 and up and you had an appointment that was canceled, we are rescheduling those appointments. So everybody who had a canceled appointment in January, we are going to try to reschedule you. So at any site you go to in Erie County or in New York State, you really need to have a scheduled appointment. Appointments are required in New York State. And we're asking people, if you have an appointment and you're already in isolation or quarantine, please don't come to any of the vaccine pods. We don't want to put the other people at risk of getting infected with COVID-19. And also, if you've had a COVID-19 infection in the past 90 days, you have great natural immunity, so you are protected right now. So we know this natural immunity lasts for at least 90 days. So we're asking people who have been infected in the past 90 days, and we know you have your own natural protection against a new COVID-19 infection, to step aside and let other people who don't have any protection get vaccinated, and then hopefully in the next couple of months, when we have more vaccine supply in the marketplace, we'll be able to get to you. So again, for any of our Erie County Health Department vaccine pods, we're asking you to bring your confirmation that you have an appointment, either in a printed ticket or showing it on your phone. And also, we need proof that you are actually in the 1B category, eligible to be vaccinated. So a proof of employment with an ID or a letter from your job, or if you're somebody who's 65 and up, just your driver's license or some ID that confirms your age. Also, once again, we are really not going to be able to get to the general public that is not in 1A or 1B for months, probably not until much later in the spring or the summer at the earliest. It's just a problem with the vaccine supply. So now I want to move on to talking about diagnostic testing for COVID-19. Recently we've received a lot of questions about COVID-19 and from our call center, and so I just want to make sure I can clarify any type of questions the community may have. So if you have a diagnostic test for COVID-19 that is looking for some type of evidence that you have the SARS-CoV-2 virus, that is the virus that causes COVID-19 disease. So if you have a negative test, that means at that point of time when you had your specimen collected, you did not have enough virus, or you did not have any virus, but you did not have the amount of virus circulating that the test could detect. So it doesn't mean that it's that 100% that you're not infected, and it doesn't mean that even though you're negative today, that you are not at risk of a new COVID-19 infection the next day. So that means if you have a negative test, congratulations, but you still have to wear a mask, social distance, avoid gatherings, to really do everything you can to reduce your risk, because those are very powerful interventions, and we know that does protect people from getting infected. So just want to compare the two most commonly available tests in our community, just to help you decide which test you may want to get. So the two main tests that we have available to our community are the PCR test, or the polymerase chain reaction test, which is a molecular diagnostic test, or the rapid antigen test. So the PCR test is looking for viral RNA in a person's nasopharynx, or depending on where the specimen is a collection, be in the throat or in the saliva, but it's looking for RNA. And the PCR test is actually the most sensitive COVID-19 test that we have available on the market. So PCR test is really the best test to decide if you don't have any symptoms, or if you are a close contact to a case, because you really want to be sure, with the most sensitive test available, that you are not infected with COVID-19 if you are a close contact. And also, if you don't have symptoms, if you are infected, you probably have a lower viral load compared to somebody who does have an infection, so you want to get that more sensitive test that is a PCR test. And right now, for most places, that is a laboratory test that you have to send out to a clinical laboratory. compared to the rapid antigen test. So the antigen test is testing for a protein on the SARS-CoV-2 virus. So it's not the RNA, it's a protein on the virus. So you really need a higher viral load to be able to detect that protein in the specimen. So it's a little less sensitive test than a PCR. And right now, the FDA has authorized its emergency use for people who have symptoms. Because people who have symptoms, we know that in general, they have a higher viral load that is more easily detected by a test compared to people who don't have symptoms. And so since the rapid antigen test is not as sensitive as a PCR test, we want to make sure that we're testing people who are most likely to have a higher viral load, and the test will be able to find that protein on the virus. So if you are asymptomatic or a close contact to somebody, if you do have a negative rapid antigen test or a negative antigen test in general, we'd strongly consider you getting a confirmatory test with a PCR, just to make sure that you are definitely negative at the time when the specimen is collected. So I just want to give you an update on what our case investigation is finding today. So I asked the nurses who are calling all our newly diagnosed cases that we've received from the New York State Health Department today, what people are reporting to them, how they think they may have gotten infected. And overwhelmingly, people are admitting that, I was at a Bills game, watching the Bills game with a friend, and so they're admitting that they were in a gathering with either a small group or sometimes a large group with people who don't live in their home. So remember, even if it's watching a football game, any indoor gathering with people who live outside your house can put you at risk for a COVID-19 infection. And so remember, we're trying really hard to prevent infection. We want as few people infected in our community because we don't want these variant strains to enter our community. So number one, making sure as many people are vaccinated as possible, and number two, that we continue our preventive behaviors, so make sure that people aren't infected by masking, social distancing, staying away from any type of gatherings of people outside your household, and most importantly, stay home if you're sick. Don't come to work, don't go to your friend's house, don't send your kids to school. So with that, I'm going to turn it over to the county executive to entertain questions.
Thank you, Doctor. I just want to note, it wasn't in the slides, but I know it's going to be a question in all likelihood. We have received second doses for everybody who previously had a first dose. So every individual who got a first dose, before we had to cancel them, people keep on asking, are our second dose clinics canceled? The answer is no. We've actually been doing second dose clinics and have one going on right now today. Had one yesterday, have them through the remainder of the week. And just to give you an example, I believe we had 7,500 second doses that were received for this week, because in the 1 week we did basically 7,500 doses for the first dose. So we're very glad that at least we're receiving the second doses, and that the individuals who got their first dose can then get their second dose at the appropriate time. So once again, if you have a second dose, or you're scheduled to get a second dose from the county or truthfully anywhere else, you're going to get your second dose. They are coming. We do know that there's a little bit more. President Biden announced vaccine that will be delivered to state and local governments, and the governor also mentioned that there'll be an increase. We're still not, he said about 20% increase. That sounds all wonderful, but when you're getting 1,700 doses, that means basically you're going to get about 3,400 more, or 340 more doses on a weekly basis. So it's not even close to where we were a few weeks ago, but at least it'll help. But right now, all we have for this week is 1,700 doses, and we're working our way through the first 2 days, which was January 18th and 19th, to reschedule those individuals and have them get vaccinated at the end of this week. So with that, I'll open it up to questions, and we'll start with WKBW-TV.
Hi, Mark. It's Olivia. I was wondering, I just want to reconfirm the numbers. You received 7,500 second doses this week, and then 1,700 doses to reschedule those appointments?
That's correct.
Okay, so then how will you guys be balancing the appointments for second doses and rescheduling appointments? Because, I mean, it's my understanding those second dose appointments have to be done a certain day.
Well, they can be done within a certain date range. They don't have to be done on a certain day, but they were pre-scheduled. We have multiple clinics. We have clinics. We have 2 clinics scheduled for the first doses at the end of this week, and then we have this 1 clinic which is running every day this week through Saturday on the second doses. They are different locations. They are not the same locations. So we know the individuals who are coming to the second dose clinic are there for a second dose. If they have no proof of the first dose and they're not on our list, they're not going to get vaccinated. So they're different locations of clinics, and the nice thing about it is we know we can handle the second dose clinic because it's exactly the same thing that we did previously at that clinic location. So we have 3 locations that are going to be operational by the end of this week, one which is the second dose clinic, which is operational right now, and the 2 first dose clinics, which are at ECC South and North, which is the locations that were previously canceled. So individuals are told to report to the same location they were at the same time they had scheduled. So if they were January 18th and they had an appointment at 3 o'clock at ECC South, well, then they're to report for this Thursday, because we're doing it on Thursday and Friday, this Thursday at ECC South at 3 o'clock. So we know who will be coming in at what time because it's based on the original scheduling. A problem that we've run into is we use the state's CDMS system for scheduling. It has some great features to it, but as we found out, and I think the state is finding out now, if you have to cancel and you have to reschedule them, it's very difficult to do it. And as such, that's why we're sending out individualized emails to individuals, and we're also sharing the information to local media and social media so everyone understands when they can get their first dose of vaccine after having had their clinic previously canceled.
Okay, just want to make sure I'm understanding. Oh, sorry.
Oh, go ahead.
I just want to make sure I'm understanding.
Go ahead.
There's a specific separate dose clinic for second doses.
Yes, it is a different location.
Okay. Okay, thank you.
You're welcome. Yeah, and the individuals for the second dose clinic have already made their appointments. They make them basically when they get their first dose. But it's a totally different location, different staff, all trained to administer the COVID-19 vaccine. WIVB, Channel 4, I think Chris Orvatis is on.
Yeah, hey, Executive, can you hear me?
Yes, I can.
Okay. Can you provide some more information on how the county will approach scheduling moving forward? I know in the past you've indicated to us that the state said you schedule the appointments. If the supply doesn't come in, cancel them. A little more recently, the governor said providers should only schedule appointments for allocations they know they're going to get. So moving forward, once we get past this week, how does the county approach that?
Well, this is going to take some time. It's basically getting past this month, because if we're getting 1,700 doses a week and we have a little over 9,000 canceled appointments, even though some of them individuals already have indicated to us that they've gotten a vaccine elsewhere, we still are going to be doing thousands more over the next 4 weeks. So the goal will be to get everybody who previously scheduled an appointment that was canceled, get their first dose. Once we get through that pool, which will probably take the entire month of February, unless we get a big increase in doses, then we will schedule appointments for first dose clinics for individuals in the 1B category that we are authorized to do, but not until we have doses in hand. So we will then open up the system, the online system. We know there's a lot of questions about seniors being able to use the online system. We're trying to come up with a system that will allow senior citizens to call in, but we're working on that right now. It is not in place. Our goal is to have it in place so that seniors who do not have already scheduled an appointment can schedule. Well, I should backtrack. We're not going to be able to do seniors in the month of March. We're going to set up an appointment system when we're allowed to do seniors. But right now, we can only do essential workers, and as recently announced today by the governor, they're allowing us, I guess, to do taxi cab drivers as well as restaurant workers as part of the 1B category. But For now, we've been told we cannot schedule new appointments for seniors. When we're allowed to schedule new appointments for seniors, then we're working on trying to have a phone system available, but I don't anticipate that coming anytime soon, Chris. So I hope I explained it. It's a little confusing. It even confused me there for a second because we've been told we can only do certain individuals, seniors who have not previously had their appointments that was canceled. They're going to have to go through the other mechanisms that exist, which include pharmacies and the state sites. When I say state sites, I'm talking about UB South.
Is it fair to surmise, though, that now that you're moving ahead and scheduling this week's appointments, I know you said you already have the 1,700 doses on hand, but is it going to be a situation where you're waiting to get the doses on hand before you offer scheduling of appointments on a week-to-week basis, or will you be scheduling prior to getting the doses on hand?
Well, we just got the doses actually this morning for this week's clinics, the 1,700. We previously had the 7,500. They came late last week for the second dose clinics. So it's, let's put it this way. I'll feel confident that once we get the allocation numbers from New York State, which is usually 2 or 3 days before we actually get the doses in hand, that we will then be able to reschedule the canceled appointments for future weeks. We will not start rescheduling those appointments until we at least get the allocation number from New York State. They have, since day one, said we were going to get a certain amount of doses on let's say Tuesday. They'll let us know that maybe on a Saturday, and then Tuesday we get the doses. So they have done that. But I would not reschedule anything until at least I know how much we're going to get for the upcoming week, which is based on the allocation number from New York State. It's a system that is out of our hands, is the best way to describe it, because we are at the mercy of the amount of supply that the state gets from the federal government and then how the state distributes it out to local governments. As I've said all along, we could do more if we had more doses. We just don't have them. WGRZ, Channel 2, is anyone on?
Yeah, hi, Mark. How you doing?
Hi, Ron.
Got me?
Yeah, I got you. Go ahead, Ron.
You just referred to it. The governor, just when during his briefing, said, okay, the counties, if you've been able to handle things, you can go ahead and deal with the taxi drivers, the Uber drivers, restaurant workers, and developmentally disabled facilities. Quite frankly, does that frustrate you? Because it sounds like you're still trying, as Dr. Burstein was explaining, you're still trying to get everybody that you had to cancel, and now the governor kind of throws out a blanket statement again saying, well, they can also start opening it up. Doesn't this just indicate again that if the governor does that, it's going to confuse people and cause you to start getting calls from those other groups, even though you've got to reschedule everybody else?
Well,
that kind of source of frustration.
The message I would like to send out, and I hope media shares, is that we will not be scheduling new appointments for any individual for at least through February, because we have to go back and reschedule the canceled appointments from January. So to all those individuals who are in this new 1B group, congratulations, but you're not going to get a dose from Erie County anytime soon. And I say that not trying to be snarky about it, but it's just the facts. The state has other sites that they are setting up, and theoretically you could try to sign up for an appointment with New York State at one of its sites, but I know right now that they have appointments full through at least April. So while the governor may announce that, yes, you can go and try to get your first dose of vaccine if you qualify as part of this subgroup, it's difficult for me to sit here and tell those people that you're going to be able to get a vaccine next week, because that's not just going to happen. It is not going to happen, at least in Erie County. And I know most of the other health departments are in Western New York and across New York State are dealing with the same thing. They have hundreds of thousands of people, depending on the size of the community, that qualify in the 1B category even before what the governor announced today. Now, one thing we announced last week at the end of the week, which I was actually kind of surprised, none of the media really picked up on, but we released actual total numbers from New York State that indicated that in Erie County, 75,000 plus individuals have received the first dose of vaccine. We were able to identify, get information from New York State on the individuals who were Erie County residents who had received the first dose, and those that were in the nursing home program. And we have a little bit better numbers on the nursing home program. I don't have it right in front of me, but as of the end of last week, we basically had 75,000 Erie County residents that had received the first dose. That's a good number considering the lack of, I think I'm re-saying the right number. I better check on that. Dan, can you look on that just to check and make sure that release is accurate? I'm trying to remember now, was it 75 or was it 57,000? But it's a decent number compared to how the lack of vaccine has been distributed overall in the greater community. So Dan Meyer from my office is checking just to make certain that I said the right number, and it wasn't 57. It was giving me the correct thumbs up. More than 75,000 Erie County residents had received the first dose by the end of last week, and that includes nursing home residents, as well as those who attended clinics, Erie County, the state's clinics, pharmacies, you name it. So we have more than 300,000 that qualify in the 1B category before what the governor announced earlier today. So if we got 75,000 that had received a first dose vaccine at the end of last week, and we know there was over 300,000 that qualified, that still means that there's more than 200,000 individuals who qualified before the governor added these new categories who could get a vaccine but haven't gotten one yet. Now, we know not everyone's going to get a vaccine, but I guarantee you there's at least more than 100 to probably 150,000 of those that qualified previously in the 1B category that hadn't gotten a shot yet that want it. I'm one of those myself. I haven't gotten my shot yet. But it is difficult because the public, Ron, that has an expectation that they're going to be able to get out and go and get vaccine. As we know, that just isn't the case because of the vaccine shortage. As we get more vaccine, we'll be able to deliver more. The faster we can get through the canceled appointments, if we're lucky and we get a lot of vaccine in the next 3 weeks and we can get those canceled appointments by the third week of February, then we'll be able to reopen our other pods once we know exactly how much vaccine we're going to get to everyone else who qualifies in the 1B, except for seniors, because we've been told we have to do essential government or workers. Aaron Ty, Spectrum News.
Hi, Mark. Continuing on with people qualifying for 1B, have you heard anything about the immunocompromised that got mentioned probably a couple weeks ago now? The state was trying to see who qualified for that.
Yeah, there was an announcement that they were going to include in 1B. There never was a guidance or an order from New York State to include immunocompromised. It's my understanding that it was taken out of 1B last week. I don't make these decisions. I mean, I can tell you I'm not happy about how the scattershot method and how this has gone lately. We're taking a lot of flack here locally, and a lot of it is completely out of our control. I know there's a lot of folks out there who are immunocompromised and feel like they should get the vaccine before other individuals, but the decision is not ours. The decision is the state. But as of this morning, the immunocompromised population had not been authorized to be included in the 1B population. It's out of our hands. WBFO, is anybody on from WBFO? If not, we'll go to Mike Baggerman, WBEN.
Hi, Mark. I have questions related to the rescheduling of vaccine clinics for people. If someone previously had a vaccine date that was canceled by the county, but then they ended up going somewhere else to get the vaccine, say like UV South, what happens to that dose that was intended for that person? Is there a standby list? And a related question on that, what challenges does Erie County face if people don't call the county if they have to cancel their appointment that was rescheduled?
Well, at every clinic we have a standby list just in case we don't get through all the vaccine doses. Once a vial is opened, you have to use that vial. And there's usually 10, sometimes 11 doses. So it's not as if there's hundreds of extra doses that would be left over that we need to all of a sudden quickly figure out who we're going to do. But we have a standby list to address what would be the extra doses of vaccines that could exist at any clinic. If an individual had an appointment that was canceled by Erie County but has since gotten the vaccine elsewhere, we want you to contact us. We want you to contact us. You can call 858-2929 and let our team know that you got the vaccine elsewhere, and then we'll take that person off the list, and then we'll go to the next person that was canceled. So right now, we're rescheduling for the 18th today, Thursday. The 19th, which we plan on doing on Friday, once we get through the confirmations of everybody for the 18th, we'll move on to the 19th, which will be tomorrow. It's a very labor-intensive process because of the system that's in place, but we're going to do it. So if you have had a canceled appointment and you got the dose elsewhere, the vaccine elsewhere, please let us know so we can take your name off the list and then go to the next person following. So if 100 people got the dose elsewhere and we're scheduled for 750 people that day, we want to know that because we can move 100 people into that clinic rather than have it be the next day. So I would ask that people contact us at 858-2929, let the call center know. And also, is just to follow up on your second question, right, which I sort of answered, we have a standby list of individuals who qualify. It's not just given to anyone. It's basically those who are next on the list. And we give them a call and say, if you can come over at this time, you'll be able to get your dose today, so we don't waste the doses. And I'm very proud that through the end of yesterday's clinic, we have not wasted a single drop of vaccine. And that can't be said for every place in the United States, but we have not wasted a single drop of vaccine. I'm very proud of the work of our team to identify those standby lists, to make certain that they get vaccines into the arms of individuals if by chance they break into a vial, which is basically piercing it with the syringe, so that all that vial, those 10 or 11 doses, are used by the end of that night. Next question, Sandy Tam, Buffalo News.
Yes, thanks, Mark. So the New York Times had recently reported about how a number of state health departments' plans regarding vaccine rollout had been shelved by the governor's office, and as well as local government plans. So I'm wondering if you believe the governor's office in the state has partnered with local governments as effectively and efficiently as it could in the rollout of the vaccine to the community in light of all that's happened.
Well, we have a plan that's been I shouldn't say put in place, we're not really able to effectuate it, but we have a plan that was drafted based on years of experience from prior clinics that we've had to do, whether it was H1N1 or issues associated with hepatitis. And we felt very confident that we could effectuate that plan if we were given the go-ahead. The plan addressed issues of location, so that there would be a major hub in the city of Buffalo at the convention center, and then two larger sites at ECC North and ECC South, with the possibility of also providing smaller sites and mobile sites. The plan also took into account equity to ensure that we were providing equitable distribution of vaccine. We just haven't been given the go-ahead to do it because the state controls the vaccines. It's as simple as that. I do know that more vaccines are being distributed to Erie County from New York State than what's being distributed by Erie County. This week we're doing 1,700. I expect that there are actually thousands more vaccines that are being distributed. We need partners. We need to have these other partners in place. But it's been frustrating because we have a solid plan with the staff that's capable of doing it. And just to give an example, 75,000 doses had been administered as of the end of last week, and I believe approximately 18,000 of those came from Erie County in just basically 10 days. We know how to get the doses out, but this is not something where it's just being vindictive against Erie County. It's the entire state. The state has decided to make a decision on how they're going to distribute vaccines. We don't get a say in that. I wish it was left more to us because we have the staff, we have the facilities that are capable of doing it, but it's not our decision. I'll give you an example. We were asked to try to help out on 3 pop-up clinics that are probably going to occur on Thursday and Friday. And the problem is they scheduled the pop-up clinics on the same day we had 3 other clinics scheduled. So it's like, well, we can't do it at this point because our staff is working at these 3 clinics. If they gave us more lead time and said, we want you to assist 2 weeks from now, we could work on that. But unfortunately, when it comes to this helter-skelter method, the scattershot method of, okay, we're going to put doses here and there, and we're going to give them those pharmacies, and we're going to give them to those health departments, it makes it tough because I know we're capable of doing more. And if they just give us more doses, we'll get more shots in the arms of people. If we heard that next week we were getting 3,000 doses instead of 1,700 first doses, we'd be able to basically take 2 weeks of the canceled appointments and put them all into 1 week and get those folks done quicker. But we've been told, at least as of this morning, that we were going to get 1,700 doses a week for the next 3 weeks. So that's what we have to work with. Anyone else that I did not call upon? If not, we'll do one round of more questions, starting once again with Olivia, WKBW. Are you still there?
Yeah. Yes, I am, if you could hear me now.
Yes. Well, what is your question?
So we're about 2 weeks out from when indoor dining reopened, and as you just said, our positivity rate is the same as last week, and we haven't had more new cases, or there's less new cases than weeks prior. What does that say to you?
I think it's still too early to talk about with regards to indoor dining. I know I myself have actually gone to a couple of restaurants since it reopened, and both the restaurants seem to be taking it very seriously with mask wearing of staff, cleaning partitions, so or breaking up of seating where they're down to 50% capacity. I think it's going to take a few more weeks to really see if there is a direct impact on indoor dining. If people are following the rules, I think it's okay. The problem is when they're not following the rules. When they start congregating, hanging out, drinking at the bar instead of what they're supposed to be doing, which is having food and maybe a drink, then that's a problem. So it's still a little premature, I believe, with regards to indoor dining. Doc Burstein's giving me the nod, yes. So I think we'll know more in another week or two.
Thank you.
You're welcome. Chris Orvadas, any more questions, Chris?
Yes, I have a question for Dr. Burstein, actually. Over the last day or so, we've seen some of the privately run pop-up rapid testing sites, clinics. What's your take on those? Should people have confidence in those, or are they reliable in your eyes if someone were to go and get tested at a site like that?
Well, we know that the good news is that there is a lot of availability of COVID-19 testing in Erie County, so that's great. And also rapid testing, an advantage is that people get their test results on the same day. Again, I can't vouch for what every single of these rapid testing clinics are doing. Laboratory is regulated by the New York State Health Department, so the county does not regulate that. Again, we have our own public health clinic, our own public health lab, but we do not regulate other laboratories. Again, people have to decide, look at the advantages and the disadvantages of the tests and decide which test is best for them. So again, a advantage of the rapid test is that it, you get your test result on the same day, usually within a half hour. The disadvantage is that the test may not be as sensitive, especially for people that don't have symptoms, especially those who are close contacts. So in those cases, people should really think about getting a more sensitive test, which is the PCR test, which is a laboratory-based test. So the disadvantage of that is that you have to wait usually a few days to get your test results back, these tests usually you have to schedule an appointment. So there are advantages and disadvantages, and just have to decide which situation is the best test for you. But I can't speak for the performance of all the clinics that are offering rapid testing. You just have to look at what are the advantages and disadvantages of each of the tests and decide what's best for you. The best thing to do if people think that they're at risk of COVID-19 because they have symptoms or because they were a close contact is to discuss this with your healthcare provider and get their advice for which is the best test for you. Thanks.
Okay. Channel 2, Ron Plants, any more questions?
Yeah, Mark, as you may know, there have been lawsuits, in one particular suit challenging hockey, recreational play, youth hockey. I believe that will be heard on Friday, or Thursday, Thursday. It gets all confusing here with all these court cases. But with that, I know in the past you've been quite concerned about spread with youth hockey, league, things of that nature. But from what we're hearing from the attorneys, they want to try to figure this out, and they say that authority, the approval level, went down to the county level, which would be your level. They are saying that they want to open up these tournaments, that they want even people from out of state. They say apparently there's a big tournament coming up in March, another one in April, which could have people coming here from other states. What do you think about that? I know this is legal stuff, in terms of the lawsuits, but what do you think about that now?
Well, they want to kill people is what it comes down to. They don't really want to kill people, but that's what might happen. We have evidence of individuals on hockey teams that have had transmission. Heck, the New Jersey Devils just shut down the rest of their week because of transmission with them, and they get tested pretty much every day. We are in the middle of a global pandemic, and we are not out of the woods yet. We're doing better, and that's good that we're doing better, but we were doing better in the summer, and then we saw a huge increase in the fall. So as somebody who coached hockey, I don't coach anymore, who likes to play hockey, I understand why this is the case that some people feel this, but their right to have a tournament with people from outside the area does not outweigh our right to be healthy and live. It's as simple as that. The actions are being taken to protect lives. And I know that people don't like that. They're like, this is terrible, you're hurting our business. Nobody wants to hurt a business. We're not doing it intentionally to hurt a business. We're trying to protect lives. And more than 1,500 Erie County residents have died. And I haven't really talked about or posted it, but I read the story that was in the Buffalo News about the gentleman who was in his mid-40s who was a hockey referee who died from COVID. So if you bring all these people from across the country where the COVID rates are much higher, and you bring them from all over New York State where the COVID rates are much higher, you're going to spread COVID. And maybe the 12-year-old son who plays on the team will catch it but not get sick, but who knows about the 40-year-old parent or the 45-year-old referee on the ice. So we have we're allowing high-risk hockey and other high-risk sports, except for wrestling at this time, to allow to play starting as of yesterday. But if any player or coach on the team tests positive, then the entire team must pause for 10 days. What we're trying to avoid are the outbreaks that we have seen among players on teams. It's not just we're talking about one player or one coach on a team got sick. We're talking about multiple players and multiple coach and player combo got sick on a team. Or parents associated with a child who got it from another child then got sick. So our goal is to protect and save lives. And as somebody who also is an attorney and still has my law license, I know that is often the case said, that somebody's right to file a lawsuit is important, and it is. They have a right to sue. But we also have a right to implement appropriate measures to protect and save lives. And the last thing I want, after what I just saw with some numbers from outside of New York State, which are still ridiculously high in some places, is a team coming from those regions to play a hockey game here where possibly a number of the members of the team, their family, because you're going to have chaperones, are sick, and then bringing it to other areas. It's just their right to play a game does not outweigh our right to stay healthy and not die. It sounds dramatic, but it is, because we're talking about 1,500 county residents who have died since March of last year from one illness, COVID-19. And that is sad, because there are individuals who died in that group who would have been with us today if it was not for COVID-19. Erin, Spectrum News.
Yeah, Mark, it's something we've talked about a whole bunch over the last, I don't know how many months, but can we go over how the positive results are reported? I think some people still have a lot of confusion about this. If someone gets tested multiple times, they just show up once in the count?
Yes.
Or do they show up multiple times?
They show up once. I'll go all the way back to the top of my screen here. And when we have 56,971 COVID-19 cases, and when we renounce cases on a daily basis, these are new confirmed cases. These are not repetitive cases. So if somebody tested positive and they go back 3 weeks later because they want to see if they're still positive, they might need it for a job issue, and the test positive, well, that's not a new case. That's still the same case. So when we release the data, as you see here, the diagnostic testing summary, the confirmed cases are new cases. They take out, when we release this data, the individuals that are duplicates. So when we say 56,971 COVID-19 cases, that actually is 56,971 individuals with confirmed COVID-19 cases. Does that answer the question?
Yes, thank you.
You're welcome. WBFO, last chance? Must be a big pledge drive. WBEM, Mike Baggerman?
Hey, Mark, pharmacies are also scheduled to get an increase in supply directly from the federal government, and that, as you know, pharmacies are dealing with the seniors as it comes to vaccinations. But how much do you anticipate this helping down the line? And correct me if I'm wrong, I believe you mentioned earlier the county may vaccinate seniors in the future. If that's the case, obviously this is great news right now.
Well, we can't vaccinate them now, but if they give us the go-ahead, which I think once we get through a certain level of our essential workers that they're telling us to do, they'll allow us to do other groups. But for the time being, the only individuals that are actually being vaccinated by Erie County this week for the first dose are those who previously had an appointment canceled earlier this week. Now, earlier in January are being rescheduled for later this week. Our goal is to get to a point where we can, once again, vaccinate seniors, but we are at the mercy of New York State. They control the doses. If I took 1,700 doses and gave them all to seniors and I was supposed to give them to essential workers, I'm fairly confident New York State would punish me and potentially take away the doses in future weeks, which is what they've threatened to do. But we'll cross that bridge when we come to it. Sandra, last question.
Yes, thanks. Maybe this is a question for the health commissioner, but there was a mention of an additional 300 doses. I'm wondering if that is supposed to be for developmentally disabled facilities
Yes.
beyond the 700 doses?
Yes, we have 300 additional doses for the OPWDD facilities. We are actually in the process. We actually have done prior clinics, which were pods solely for the developmentally disabled and other type of disability community that is in these New York State OPWDD facilities. So we've been given another 300 doses specifically for those residents and staff at those facilities. That is different from the 1,700. We've been told we cannot use those doses for any other category except for the OPWDD category. So for us, it's not even really something open to the general public or cleaning up the canceled appointments of the past. We are working with local facilities that are registered by New York State. Actually, New York State actually gave us a list of the facilities we have to do. And of course, there's a lot more facilities and residents as well as staff than 300. So that's something we're going to be doing over the next few weeks as well, assuming we get the additional doses for the OPWDD community.
If I could just ask one other quick question. The health commissioner had also mentioned about consequences, and you also just alluded to it, but if you vaccinate seniors when you've been told you can't, that there would be consequences. If you could just elaborate a little bit more on that.
Well, we've gotten some pretty strong guidance from New York State saying once you get your new doses, you can do these categories and these categories only, and if you don't, you will have some sort of consequence. I don't know if that means they're going to reduce our doses in future weeks. That sort of is the impression that we've received. I would like to be able to open it up to the entire 1B category, which includes seniors and now restaurant workers and the like, but we can't. So for now, we are doing our best to reschedule the appointments that were canceled in January. There were over 9,000. We have 1,700 doses this week, so we'll chip that down to a little over 7,000. If we have a lot of cancellations because people got the doses elsewhere, that'll help us reduce that number again. But for the foreseeable future, the rest of this month, unless our doses increase dramatically, we will still be cleaning up the canceled appointments for the remainder of this month. And so that's why I don't want people to think they're going to get an opportunity to reschedule new doses. Now, on that point, yesterday, there was a glitch in the system. Rescheduling our appointments. The state heard we got 1,700 doses and we were rescheduling our appointments. So they put online first dose clinics for Erie County. And by the time we caught it, over 1,100 individuals had signed up for an appointment. They're not getting their appointment. We had to contact every single one of them and let them know this is canceled. These two clinics are for rescheduled, and you are not a rescheduled person. Only those who are rescheduled will be getting the clinics. So we had to do a lot of cleanup because of the system that's in place. We didn't authorize, the state knew we were getting 1,700 doses. They knew we were doing these two clinics this week to catch up. But for some reason, they put the link online, which we're not even sharing with individuals, and all of a sudden, people started signing up for them. So we had to cancel those. Those people will not be included in the queue of cancellations. Only those who had appointments canceled in January will be in the queue for cancellations. So for those who may have signed up real quickly at 10 o'clock last night, I recommend you go search elsewhere because it's going to be some time before Erie County can open up clinics to the general 1B category again. And as a follow-up, the 1A category is still not finished. Most of them are in their second dose now, but they're still not done with doing the vaccine doses for the 1A category. So it's going to take a long time. I was glad to see President Biden announce that they're going to release even more doses in the next upcoming weeks. We need as many doses as we can get because hundreds of thousands of Erie County residents want the vaccine but can't get it yet. And the sooner we can get the vaccine, the quicker we'll be able to do it. We have the capability, we have the staff. Heck, I want to start getting our mobile unit out there and doing small doses in the rural and inner city areas where we can have 2 people inside the unit in exam rooms. We're going to be giving a quick little tour of that very soon so people understand we have the capability. We have the freezers. We can hold over 100,000 doses. We just don't have the doses. If the state would give us more doses, we'll get it done. I guarantee it. With that, we've reached an hour. I want to thank Kendra Schmidt, who always works very hard for that hour. She must have much stronger arms than I after all the work that she's done over the last 10 months. So thank you, Kendra. I want to thank Dr. Burstein. And thank you all for participating in our COVID-19 update. We do not anticipate having another COVID-19 update this week. If there is some major change, we of course would let media know. Otherwise, until next Tuesday at 2 o'clock, I hope everyone is safe and well. And we're working on it. We're trying to get the vaccines out as quickly as possible. And if we get more doses, we will. Be safe and well. Wear your mask. COVID-19 is still out there and people are still dying in our community from it. Thanks, everyone.